Welcome to this week's edition of Health Insurance Today on radio, on Lagos Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. This program is brought to you by A-Star Communications Limited, and we are your host. I'm your host today. My name is John Omoaka. Well, last week we discussed the topic, care for the elderly, and during which the guest shared his experience about how having a health insurance plan has positively impacted his health and that of his family. We got a lot of calls, feedback, and inquiries on that episode. Well, we thank you and hope that you learned one or two lessons. On today's show, we shall be discussing you and your health, safe use of medications. A very important discussion that focuses on the safe use of drugs and medications as a way to promote our health. Well, our guest, who is an expert in drug matters, is right here with us in the studio to share thoughts with us. In the course of the program, we would also open the phone lines to take your calls and answer your questions on the topic of the day. You're still on to Health Insurance Today on radio. And joining us in the studio today to discuss you and your health, safe use of medications, is an experienced pharmacist and healthcare leader. She is pharmacist Mrs. Biola Paul Ozie, Chairman, Healthcare Providers Association of Nigeria, Lagos State Branch. She's also the managing pharmacist, High Rock Pharmacy right here in Lagos. Pharmacist Paul Ozide, you're welcome to the show.
Thank you.
All right, so Pharmacist Paul Ozie, let's start by asking you, what are medications, by the way? Is there any difference between drugs and medication?
Yes, thank you very much for that question. I want to say that drugs are anything as it were that can alter your physiological functioning. If it can alter it, impair it or improve it, it's more or less their substances. Whereas we can say all medications contain drug substances, we cannot say all drugs are medications. And that's why at the very beginning like this, I should say there is a difference between drugs meant for medication use and drugs that we call hard drugs.
Okay.
So that's why the World Health Organization have informed us, have told us we should be using the term medicines when it comes to like day-to-day uses of drug medicaments.
Fantastic. So
Yes.
in nutshell, we can say that all medications are drugs, but not all drugs are medication. Well said. But these days, we see almost everybody in the streets, in the community, handling or trading drugs and medications. Who should really be responsible for proper handling and management of medications?
Thank you very much for that. Now, for the management of drugs and handling, as you have mentioned, the pharmacist that has been trained is the person at the center of drug management, drug distribution, drug dispensing, as it were, to patients, to end user, to consumers. The pharmacist at the core. But when we talk about regulations, we have bodies, corporate, government agencies that are responsible for regulating the practice, the drug products, the manufacturing, the production, the sale, the marketing. Like we have the Pharmacy Council of Nigeria that has been established with the Act 31 of 2022. That act was newly introduced about 3 years ago. That body, the Pharmacy Council, regulates pharmacy practice in all its ramifications. And we have another agency, the National Agency for Drug and Food Administration. That is NAFDAC, popularly called NAFDAC. They are responsible for regulating the importation, manufacturing of drug products. And we have a third one. I mentioned hard drugs. Because of hard drugs, the illicit use of drugs, we have the NDLEA, National Drug Agency, not NAFDAC now, NDLEA, that's responsible for monitoring, for overseeing illicit use of drug products, especially controlled products and what we call psychotropic products.
All right. Joining us right now is my co-presenter, Regina Chris-Ogbodo. Welcome.
Thank you very much, John, and hello, everybody. Well done, Mrs. Abiola Paul Uze. Good to see you.
Okay, so we've been talking about you and your health as regards, the use of medications. So, experts have said that genuine medications are critical to effective management of diseased conditions. So how can we eliminate or reduce the menace of fake drugs, which puts people's health and lives at risk? And how can people identify fake or expired drugs also?
I mentioned already to you the agencies, the government agencies that are supposed to be regulating pharmacy practice, drug products. I mentioned Pharmacy Council of Nigeria, which is responsible for the practice, the personnel, and the premises where drugs are sold. I also mentioned NAFDAC, that is responsible for the drug products, the quality and the safety of the drug products. NAFDAC is responsible. But I must quickly tell us about a particular guidelines that was introduced, that was signed into law since 2012. That was during the regime of former President Obasanjo. The National Drug Distribution Guideline was meant to streamline her distribution activities as it relates to medicine, drug use, the distribution of drug, the dispensing of drug, and all that. Unfortunately, up to this time we are talking about, we have not been able to fully implement. We've not even done much about the implementation of that National Drug Distribution Guideline. It was something put together to help us so that the chaotic situation we have in our country regarding drug distribution and drug getting to the hands of people it shouldn't get to will have been addressed. I feel if the government with strong willpower will implement the National Drug Distribution Guideline, we would have, to a great extent, address the issue of fake and substandard.
Now, I was going to chip in here, sorry to hold your breath a little bit, because exactly you're responding somewhat to the question I was about to chip in, talking about 2012 and a law or whatever we want to call it has been given and nobody is implementing it. Now that explains why we see a lot of indiscriminate, whether you call it use or even distribution of that. Now, that brings me to this question, because we need to talk about, you talked about Lagos State, government generally using the willpower to make sure that this is implemented. But what role is your association, Lagos State, playing in ensuring that Nigerians have access to genuine and safe drugs? That works. I think it goes, talk about, identifying real drugs should be very important. So what role is your association playing?
Formerly, I was a chairman of the Association of Community Pharmacists. Like I mentioned, pharmacists are the center point of distribution of drugs and dispensing of drugs, as it were, and pharmacare. But the association I currently lead is the Healthcare Providers Association.
Okay.
In the Healthcare Providers Association, what we do mainly is capacity building, because we are the professionals, the providers that are involved with health insurance. And because of that, anybody that government is accrediting or enlisting to become a provider of any form of services, they must have been registered by the relevant regulatory authority. On the issue of association, I know the Association of Community Pharmacists of Nigeria, in particular in Lagos, they do a lot of health outreaches, campaign against drug abuse. They mark all these World Health Organization days so that as to enlighten members of the public on the right use of medicine, where they ought to get their medicine, and when they have issues, who they should go to. And one of the things that association has been able to put in place is what we call the Green Cross sign. That's the
pharmacy sign.
And we say anywhere you see that particular signage, you should go in. You are free to ask the person there you want to see the pharmacist.
Ma'am, I'm going to put you on the spot here, talking about that sign. I'm so interested in this topic because I have experiential, talk about that. That sign, it's no longer looking like it's very efficient. Let me not be judgmental, but I've seen that sign and I see a lot of funny things being sold along that kind of a place. I see a sign, I'm moving thinking that is a pharmacy, and I got to see alcohol. I've seen a lot. And so every day I ask myself, who are the people in charge of this? And I can tell you spots that I've seen this across. I know jokingly somebody talked about it in Edo State, that you hardly see a pharmacy without some ridiculous products being sold with same cross and green in it. How do you deal with what I call people that go against such rules? Because you check, you see that they are so-called certified. What do we do about that?
Okay, like I said, the Green Cross sign shows that a pharmacist is in charge of that particular premises. This that you are bringing to me, that you have gone to some pharmacy and you see variety of products. Number one, I want to say that it's not uncommon, unusual that pharmacies carried a lot of other products apart from drug items, medicine. But what I don't know is that carrying alcohol is something I've not had, and I'm hearing it for the first time.
I think from today I'm going to take a picture of that.
Yes, I think amongst ourselves, we might need to call ourselves to order regarding this, because when you walk into an healthcare facility or a pharmacy, the image should portray that what we give out here are medicine. And then because we want the public to have confidence in such premises.
Exactly.
So that is an area we'll look into. And like you have said, I told you about the Pharmacy Council of Nigeria.
Yes.
The Pharmacy Council of Nigeria have a whole lot of laws, regulations guiding pharmacy practice. And we are not only registered, it's not a one-off thing, it's something that is continuous, it's an annual thing. And as they check, they will bring anybody that's not measuring up to do.
All right, thank you so much, pharmacist Mrs. Biola Paul Ozie, for sharing your thoughts on that. And then real quick, we'll need to give you updates as regards traffic situation right now. We hear that the road rehabilitation work is ongoing at Jakonde intersection in Wachisco by men of Lagos State Public Works, and our traffic managers are firmly on ground, and they are managing that situation as well. And earlier on, I told you about the Jegule Apapa, that we have a very good traffic flow, because flatbeds are streamlined to one part of the road while the other lane is open for other vehicular movement. That's where you can have better movement. In all of that, no impediment recorded in all the nooks and crannies of Jegule Apapa. And it's also a part of what we've been talking about on health insurance today on radio. Feel free to call our studio lines. We want to hear from you as well. Questions or observations, do it to call our phone lines right now. They are open 0915 3877127, or you can send a WhatsApp message to 0809 912 0777. Health Insurance Today on Radio continues.
Glad to have you. Yes, it's still Health Insurance Today on radio, and we've got, John and I have got a wonderful guest. We've been having great conversation on the usage of drugs, personal safety, whatever you want to think of. Some of us, we must tell ourselves the truth. We somehow must have abused drugs unknowingly, and this is why we are on this program, so that we can learn. And we have pharmacist Biola Paul Ozier with us, giving us real answers to the real questions. So we will continue. We're asking questions, but don't forget that you must, or you should rather, call us and ask any of the questions. John, could you help by calling the numbers again?
And the number to call is 0915 3877127, 0915 3877127, or you can send a WhatsApp message to 0809 912 0777.
Okay, pharmacist Biola, let's ask you this question. I think it's very, very important to me personally. What are some common mistakes people make when taking medications, and how can they avoid these errors?
Okay. Now, what are the common mistakes? Number one, people do take drugs when they don't even need drugs. Like somebody, you are so tired from work, and you feel that, yes, the next thing, let me get sleeping tablet. There are some sleeping tablets that are, controlled medicine.
Okay.
So they will just go about looking for that. If I can just take this, take that, I don't want to mention their names, I will be okay. No. There are times, what we call conditions that are self-limiting. People go ahead and they take antibiotics for it.
Okay.
Like diarrhea. It's not all diarrhea. In fact, most diarrheas don't need antibiotic. But in our climb, people abuse antibiotic. Before they started stooling, they're already buying
certain drugs.
Some drugs. Tetracycline, common, Flagyl, and things like that. It ought not to be. Some, like I said, they are self-limiting. The way they came, they are going to go. Just give it some time. Then, what are the other errors? Some people, they start their medications. We have had encounters where people will say they are taking anti-malaria. They will take it for 1 day or 2 days, they feel better, and they push it aside. And then, when next they come and they give you symptoms, and then you say they have malaria, and you are talking to them, interacting with them, what happened? When last did you take an anti-malaria? Did you test and all that kind of a thing? They say, you know what? And you are offering them a pack of anti-malaria. They are telling you, you know what? The one I used last 3 months ago, I see there. You know those 4 I only took 2 doses and I left it. No, that's wrong. We are going to cause resistance to happen to the few available anti-malaria. The same thing with antibiotics. When the doctor writes it for you for 5 days, the doctor meant you should use it for 5 days. Another common error is sharing your drugs. In fact, this is common. I can't say it's common. It's rampant. People
what do you mean by sharing?
Yes.
You mean
you got the drugs, you saw a doctor, you complain, I have headache, I have backache, I have this, and the doctor wrote something for you. You took it, you still have some left, and you kept it aside. When a friend, a relative has something similar, you just become call it a community doctor. Immediately you are telling the person, oh, the last time I went to see the doctor, he gave me this. You too, you can take.
Madam, let me be the devil's advocate here, because we were talking about, we're always advised to have a first aid box. So what difference does that make? If someone feels, okay, someone is complaining of certain thing that you can guess, there's a first aid box. Why not give him? Because we're asked that certain drugs that should be found there.
Yes. First aid box is a yes in every household.
Okay.
Especially for those that have little children. It's very, very important. But what we call that is responsible self-care. There are some things. Sometimes you have some wound, you have some scratches, you need to use plaster. If you don't have those things in-house, you won't be able to do it.
Okay.
Sometimes somebody just feel headache and then you need paracetamol, and if you don't have it, you won't be able to use it. So we have responsible self-care and irresponsible self-care and irresponsible use of medications. And that's what we are dissuading people from. Don't drug anyhow. Don't use drug anyhow, because we say drugs are poisons.
Well,
they can do good and they can...
Pharmacist Paul Ozie, when you were talking about sharing of drugs, I was thinking you're coming from the angle of, because of the economy. Drugs are quite expensive these days. And maybe that's why the friend is like, okay, you know what, you can use this.
Exactly.
I have the same experience. But then, since drugs are expensive, what is your take on, how can we actually help ourselves to get these drugs, at least perhaps, to manage the economy, so to say? What advice would you have to...
When this current government came in, they talk about unlocking the value chain in the healthcare system.
Yeah.
And the president has been trying, together with the Minister of Health, the Ministry of Health. What we have, there was an executive order signed so that manufacturers can manufacture drug more easily with some tariffs, some levies that are taken off, as it were. But I think we are yet to begin to see the effect of that. Your drugs very expensive. You enroll under the health insurance plan, any plan for that matter, whether in the private sector or the public sector, you are bound to get medicine relatively, almost like free once you are already enrolled into the system. So that's one of the options people should go for when it comes to when you don't want to just be spending money from your pocket every now.
I think you are reiterating what we had 2 weeks ago. We had a guest to talk about that, talking about the out-of-pocket people. It's like a culture. We inadvertently think it's normal for us to pay for our Medicare, but now we're getting sensitized, and this program is doing a great deal in telling the world that, or Nigerians particularly, that you can take care of yourself, not really directly from your pocket. And health insurance today on radio is helping you to know where to go to.
Well, are there medicines, let me just ask, medicines generally that are covered under the health insurance policies in Nigeria?
Yes, most medicines are covered under the health insurance policy. Let me quickly say this. Like I said, the government has introduced the National Health Insurance Authority, that's the body. But health insurance is now made mandatory. It is mandatory. As of last year in Lagos, the Lagos State government, the executive governor, Governor Babajide Sanwo-Olu, issued an executive order to tell you that what National Health Insurance Authority has asked us to do, make health insurance mandatory for all residents, is ready to implement it in Lagos. And that together with the Lagos State Health Scheme, the Lagos State Health Management Agency responsible for the health insurance plans, that they are ready to make sure that Lagosians take up at least one health insurance policy, so that, or plan, we don't call it policy, plan, so that when the time comes, nobody plans to get sick. So when you get sick, you don't have to stay in your house until it gets worse. You can just walk into a clinic, whether a primary health care center, a general primary health care center, private health care providers, hospitals, private hospitals, whichever one you have chosen, and then you see a doctor. When you have seen a physician, the physician will write the drugs for you. Lagos State are taking it further, community pharmacy in your various communities are also dispensing drugs under the Ilera Eco plan and other health insurance
Thank you very much. But I think this question needs to be asked so that clarity can come in. When I travel abroad, when you get drugs, there's a call.
Sorry, Roberta.
Okay.
Regina, we have a call.
Okay.
Hello.
Hello, Mr. John Omoaka. Good afternoon, or good evening. This is Dr. Busari.
Oh, Mr. Busari, welcome.
Thank you very much. Good. My greetings also goes to your guest. You see, you talked about the expensive nature of these drugs. But in the present day in the country now, one can see that you have a lot of proliferation of fake drugs in the country. Yes. I want your guest to please tell us what measure or what are they doing to ensure that there's a curb in this aspect. Thank you very much.
Thank you for calling.
I'm sure you heard him, ma'am.
Yes.
Okay.
Yes. Thank you very much. Though I'm not a government representative, but I'm aware some things are being done. Like there's this traceability GS1 that NAFDAC has been partnering with some non-governmental agency to introduce in Nigeria. With that, we'll be able to trace drug from manufacturing to distribution to the point it gets to the community pharmacy and then subsequently get to consumer. It has just taken off. Community pharmacy have been asked to come and enroll so that with that traceability, we will be able to know any drug that comes into the country or any drug that is manufactured and put into the system. It can be traced all along. Then the pharmacy council to have a responsibility to do what we call audit trail so that we know where the drugs are being sold to, where they are being carried to, and how they are going all around in the value chain.
Well, thank you, Dr. Busari. I hope you got that question answered the way you are being a doctor, so you understand yourself better. Well, I want to say thank you to you, pharmacist Mrs. Biola Paul Oze, Chairman Healthcare Providers Association of Nigeria, Lagos State Branch. Of course, you're also the managing pharmacist, High Rock Pharmacy, isn't it? In Ojodu. We thank you for sharing these useful tips of the topic of today. That's you and your health, safe use of medication. We also want to say thank you to our listener for tuning in to Health Insurance Today on radio, brought to you by A-Star Communications Limited. We hope you found our discussion on informative and helpful. Now, do you know you can get all the drugs you need for whatever conditions the doctor might have diagnosed if you subscribe to our health insurance plan today? And if you would like to know how to subscribe to health insurance plans for you, your family or organization, or you just want to know more about the topic of today, please call us or send a message to 0901 538 8634. You can also email us on info@healthinsurancetoday.ng. Don't forget to tune in on Friday next week, same time, for more information and insights on health insurance. Until then, I say stay healthy. John?
Stay informed.